Good afternoon. Hopefully you had a good weekend. Not bad numbers today. No new deaths over the last 24 hours, so that's good news. We've lost 675 of our neighbors in the pandemic, so certainly want to remember them and their families. 7-day rolling average, 0.7, so down a little bit. We've been trending below 1% for 3-4 weeks now, so very good job. New cases, we've now had 32,043 positive cases. That is 66 new cases. We have 579 active cases. Since March 1st, we've only had 5 cases in senior facilities, so that's good. Obviously, a direct correlation with our seniors getting vaccinated and the caseloads going down. We put up over 2,000 new appointments online, available Wednesday through Friday this week. Currently, they are open at ongov.net. We haven't heard on eligibility yet, so that's something that we've talked about, looking at increasing eligibility. There's a lot of supply right now, and moving forward, it's getting harder and harder to fill the appointments. That's a good sign. Increasing eligibility at this point, I think, is warranted. So we've shared our thoughts and intelligence with the state. Hopefully they move on that in the near future. We're doing a pop-up clinic tomorrow at Brighton Towers. It's an independent living facility, City of Syracuse. We're going to go there and vaccinate the residents who have not been vaccinated. Also tomorrow, we're going to be working with our homeless population and doing a pop-up clinic at the rescue mission. So it's important that we make sure nobody gets left behind in this process. All of us are vulnerable in the pandemic, but including our traditionally vulnerable communities, such as the homeless population. On-list, tomorrow's clinic is heavy focused on on-list. I'll get a report in on this, but our on-list, which started with 10,000 seniors who have a hard time competing with the registration process, we could be exhausted by that, which is really good news. But I'll have more to say on that on Thursday. So overall, the vaccination, today we'll go over 25% of our population. We're over 31% of our adult population going into today. And again, out of our adult population, not everybody's been eligible to receive a vaccine. So we're doing well. We're vaccinating at higher rates than other counties, and people are participating. Many of the groups in 1B, we've set aside appointments for, we schedule appointments for, and their access to vaccine is not a challenge for the groups in 1B at this point. When you think of law enforcement professionals, frontline workers, you think of educators, access is not a challenge. We've been setting aside, and it's for us to get people into the vaccine for those groups now is more of a challenge. So kind of really good stuff there. Testing, again, I'm a broken record on this, but please, if you have symptoms of COVID, we need you to test. And any symptoms, you have to rule out COVID. That's as part of Team Onondaga, that's what your responsibility is. Again, symptomatic testing, ongov.net/Cougar Medical, Monday through Friday, 9 to 1. On weekends now, upstate will be doing the testing. On weekends, Saturday locations at the fairgrounds from 8 to 1. Community hospital from 11 to 4. Sunday location is at community hospital from 11 to 4. For upstate, you go to mychart.upstate.edu. You create a login, and you can register for a test, symptomatic. Asymptomatic testing, we've been doing asymptomatic testing here at the On Center 4 days a week. In addition to that, we've been doing community sites. You can go to ongov.net and register for asymptomatic tests. Today we're at East Syracuse. Tomorrow we're at Northeast Community Center in Shove Park. Wednesday, Fayetteville Village Hall, Town of Clay Senior Center, and the Skaneateles School District office. Thursday, Onondaga Town Hall, and Friday down to the Southern Towns at Lafayette Community Center. In addition to that, school testing is going on. We've been testing for schools ever since before orange and yellow zone testing. We were testing in schools. So again, working with all schools to continue to test, try to find that hidden case to make sure that that one case doesn't become 4 or 5. We'll come out on Thursday with details on our rental assistance program related to some of the stimulus money we received from the U.S. Treasury Department back in December. And then it looks like this latest stimulus plan may have more funding for that. So we know the need is great. We will have a program detailed on how we're going to implement that in the process for landlords and their tenants to participate in the applications. I know that people probably have questions about it, but we're pleased with the United States Senate. I understand that in a $1.9 trillion bill, there's going to be things that people don't like, and that there wasn't a lot of agreement on all of it. But one of the things that, just from a principled standpoint, the federal government told us to shut down our economy last March and April, as did the state of New York. And when you do that, that's a mandate. There's economic hardships related to that. And I think overall, everybody's done a nice job responding to those hardships in previous stimulus packages for different industries. But the one industry that, or one large employer that really wasn't helped was the one specifically doing the work on the front lines, and that's us. So I'm very pleased that it looks like we're going to get relief. $89 million is a lot of money. Between 2020 and 2021, we have cut $120 million. So really, this money is making us whole of lost revenues and or expenses that we've cut. And it will allow us to have our own stimulus initiatives here at the local level, being a large employer and being hundreds of businesses' biggest customer as well. So pleased. It is. We made tough decisions. So could people say it's not an emergency for you? No, it's not, because we already made all the tough decisions. But $120 million that normally would have been spent in the economy never went into the economy because of the pandemic. So replacing lost revenue, I think, is consistent. So we didn't have an unfunded mandate. But saying that, happy to take questions.
The 2,000 vaccinations given out today, were those left over from the Wednesday to Wednesday, or those are brand
So we're still, so again, we're in Monday. We're still in we're still in vaccine week. So part of those tomorrow as well. Those clinics are all from last week's distribution. How it's working on vaccine supply now is, and again, this worked last week too. We got notice of 3,300 new vaccines for this week. There's a call as we speak right now where we can ask for more. We're going to ask for some more. But the reality is, if you don't open up eligibility soon, you're going to have challenges, especially considering the amount of supply that's at the fairgrounds, and your pharmacies are still getting, I think we still had at least 3,600 doses for the pharmacies for next week being a Wednesday to essentially Wednesday. So the some of the appointments for later in the week is based off of the new supply, but today and tomorrow's clinics are related to actually last week's supply.
So you're saying that you've said for weeks and months that we can handle much more supply and everything like that. Is it time to open up more eligibility to larger groups of people?
I think so. I think it is. I think you can do two things. I think you can lower the age. We know the 50 and above, it's a pretty good idea for us to go from that 50 to 65 age group. Right now, we've had bad outcomes with people as young younger than 50, but I think we had a 51-year-old we lost last week. Now, if you're in that age demographic and you have an underlying condition, you can get the vaccine still. But I think that's a good idea, 50 to 65, and I think there's certain segments of the economy that have been open throughout the pandemic that haven't been allowed to get vaccinated. I think that makes sense. And the other thing, too, is think about the segments of the economy we kept shut down longer. Why did we keep them shut down longer? Because there was more risk. Well, there's still more risk then. So your hairstylists and your barber shops and these types of businesses that got activated later on, they should probably become eligible as well. So I think we're at the point now where eligibility, hopefully this week, will increase, and we'll be able to, once again, you'll have a situation for the first few weeks where not everybody eligible will get a vaccine, but there's enough supply now that you can really put big dents into those groups.
When you get your $89 million check, what's priority one with that money?
Yeah, so really, Andrew, what this will allow us to do, and I'll break out our plan at our State of the County address on March 31st, is this will allow us to reactivate. First, it will allow us to respond to the ongoing challenges in the pandemic still. We're not quite through it. But the next phase of the pandemic is recovery, and it will allow us to reactivate our planned investments, helping people, addressing poverty, modernizing our infrastructure, and developing economic development opportunities. As we know, the best way out of poverty is a job. So we have detailed things we wanted to do in 2020 and 2021 based off of what we call our PI platform, which is what I ran on in 2019 and got elected on. And the pandemic put that to a halt, essentially. So certainly this and potentially what the state does allows us to continue to end this pandemic and respond to it, shore up operations that are having challenges, and then reactivate planned investments that we've already had.
You've been asking loudly for money for many, many months. But in some ways, is this coming at the right time? Instead of that money going to actual pandemic expenses, it sounds like it's timing out to go to investing in the future.
I think it is. I think they call it a stimulus package. I think because we made the hard decisions already, this is what this will be for us. And it will help drive our recovery probably better than other municipalities that have been pushing off tough decisions.
What's the hardest decision, do you think? What's the biggest chunk of county government that's not currently functioning that you'd like to see return to normal?
It's tough. It's really tough to tell because on the human services side, you still don't have normal socializing patterns yet. We still don't have our kids back in school all the time. They're getting back to school because a lot of the work our team's done. But we know mental health is a huge crisis, right? So we're going to do some things to address that. We have to re-engage the community on the opioid crisis. Certainly, child abuse is an issue that we're getting our arms around now and making larger investments in those areas as we speak. So there's the human service side, workforce development, trying to figure out who's out of the workforce and getting them back in. And then there's, once you have a trained workforce, that's an asset for the economic development opportunities. But also you got to have infrastructure to deal with it. And specifically, we have some investments we want to make that will help support struggling industries like hospitality, tourism, and et cetera. So we have a lot of things that we're going to unveil.
Are those all new projects, or did those areas suffer from cuts because of the pandemic?
Some of the projects that would have happened didn't. There's some areas that had cuts that will get shored up. And then there's some new opportunities that we think will fit nicely into some of the parts of our economy that have been struggling.
This is kind of an open-ended question, but I think the pandemic has changed or at least challenged a lot of people's views on how big areas like education work and the economy works. As you think about investing in county government and in economic opportunity, has your perspective changed? You have different priorities now, would you say?
Yeah, I think when you've been put to the challenges that I think we have as a government, you realize a couple things. You realize real quick where you're strong and where you need work, and you realize where in government, even though we have basic functions and responsibilities, where we're better suited to do the work, and then where our partners are, our nonprofit partners as well. So I think the pandemic's brought clarity to that, and we'll be better moving from that. I think there's issues like the digital divide that are immediate issues that have to be addressed. The pandemic taught us that broadband infrastructure probably as critical as any road or bridge now, and so we've learned these things during the pandemic, and so we're going to take these lessons, and now we have a funding stream to help address some of these issues, not just for the immediate future, but for the long term as well. So I'm excited about it. I think we're going to be able to do some things regardless of what happened in Washington, D.C., but I'm excited about the opportunities now. If you look at what you can spend the money on, you can do lost revenue. We can show over the amount of money that we are receiving in lost revenue alone. But in addition to that, you can support industry, tourism, hospitality that have been impacted by the pandemic. In addition to that, you can invest in sewer and water and broadband as well. So some of these other municipalities are probably going to have a hard time identifying losses, so they'll have to look in these other areas to spend money. But it's a unique opportunity for governments to shore up some of these areas. You can give support to small businesses too. So even if you're a town that got a little bit of money, you didn't have any losses, you don't own sewers and you don't own water or broadband, right? So you can't spend it there. You can probably develop small business programs for businesses in your towns. So there's things that can be done. But I think overall, Tim, the pandemic's taught us where we're strong, where we're not strong, and where it makes sense for us to be the lead and where it makes sense for the partners to be the lead. And it's really heightened the need for certain infrastructure in the community. And we're going to learn those lessons, and we're going to implement the changes necessary.
You've told me that the county doesn't have any unpaid pandemic debt. How are you able to pay it off without increasing revenue? Just more cuts?
Yeah, if you look at what we did, we cut $40 million mid-year last year. So, again, most of those cuts in the 2020 budget, there were a lot of things that we would have liked to do, right? A lot of our initiatives cut. The only thing that mattered was the response to the pandemic. We had to, at the time when we were making these decisions, our economy shut down. Our sales tax payments are dropping like 40%. The state of New York saying you're going to get a 20% cut. We don't know what's going to happen when we're making these decisions, so we have to go and we do 2 retirement incentives. So we'll save personnel lines there. We had to eventually furlough, and I think we laid off a handful of employees. So we did all that when things looked like they were going to be really bad. Sales tax picked up at the end of the year, which was helpful. Wasn't as bad as what it looked like it was going to be. The state budget cut, there's going to be a cut, but it doesn't look like it's going to be 20%, so we'll pick up savings there. So 2020 might end up being, as we close out our books, not too bad. 2021, though, again, we cut $80 million because same things. You don't know what you don't know. In the middle of the budget we're preparing for 2021, we were experiencing the second wave, which was worse than the first wave by many multiples, right? And so you're doing that. Again, they're talking about state budget cuts. You're going to have revenue losses because even if you're growing in 2021 from 2020, your sales tax went down, so you're just picking up a little bit. So overall, we made the tough decisions, and because of that, we didn't have to go borrow for revenue or operating like other municipalities did when they're waiting for help. So now we're in a better position now to rebuild and recover.
Do you remember how much you've spent on the pandemic?
Tough to monetize that number, especially at the end of the year on personnel costs. Remember, county government basically became a large health department during the second wave. So all that personnel went there in addition to well over $7 million, from FEMA reimbursed requests. So again, that went into this year too. So the pandemic response outside of our health department, basically all they've done is this, essentially. We had hundreds of other employees basically working for the health department in the second half and the beginning of this year.
We're kind of flattening out at 65 cases a day, but the positivity rate is really low. It's as low as it was last summer when we had, maybe 8 or 10 cases a day. Are you expecting to see the numbers continue to decline, or are we kind of stuck here?
I think we're going to be.
Over?
Yeah, I think we're going to be in that 40, 75 range. If you look at the days, you get a couple higher numbers. You're getting a lot of tests back. So if you're going to have 11,000 tests or 12,000 tests in a day, you're going to find some virus, even if you're going to find asymptomatic virus, right? So I think we're going to be in that 40, 75 range. I think once the windows get opened up, we'll get lower. And once you're, eventually, once you can vaccinate the younger demographic, that 20 to 40-year-old demographic, I think the virus is going to really be on the run. That demographic doesn't turn into hospitalizations as much, so they'll probably be waiting in line for a while. But that's essentially, we're seeing a younger demographic with the virus, which is expected, right? So the good news is that we're not seeing it in over 65 as much. We're not seeing it in senior facilities as much. That's why you've seen the hospital number stabilize. Today it's 57 in the hospital, but it's a Monday. The hospitals don't really discharge over the weekend. So I think we'll see the hospital numbers continue to drop a little bit each week, and eventually I think that number gets a lot lower. Other
All about vaccines and getting more vaccines. Is that kind of now the Hunger Games of trying to get vaccines in this community? And why do you think that Onondaga County should get them when other areas don't have any for those places?
Well, Trish, I'm the county executive of Onondaga County, so I think we should have all the vaccine. Until that changes, that's my answer to that. But no, everybody gets allotted a base allocation. And then in addition to that, some counties don't have the infrastructure to do what we can do. That's the reality. And so when there is available doses, some counties, for example, can't handle Pfizer, or they only want Moderna. So depending on all these factors, we've had, the last few weeks, we've had calls at 3 o'clock, and we get to ask for more. And last week we got what we asked for. This week we're not asking for as much, but we'll, essentially getting 6,500 doses is essentially getting 13,000 doses because you're going to have second shots worked into the first shots eventually. So the overall, we can do more than that. And as soon as we don't feel the pressure to be able to do more than that right now because the demand isn't there. It's not as much demand. As soon as things get opened up again, we'll be asking for more.
You're Republican. You're Republican. Your thoughts on not one Republican senator voting in favor of the stimulus?
Well, part of it was to be blunt, Andrew, from a local government perspective, counties and other states got CARES Act funding sent to them from the state. New York State kept our money. So that's part of the issue. The other part, again, it's disappointing that that it wasn't a bipartisan vote. You could have had, certainly there's enough good in the bill to support it, but Washington, D.C. is a very partisan place, and I testified for 3.5 hours the other day before the Homeland Security Committee, and I could feel the partisanship in the questions I was receiving from the left and the right. So it doesn't surprise me that a lot of this is party line. You know, there might be some Republicans who vote for it in the House. If you saw that, they'd probably be from the 2 states that didn't share money with local governments, right? There might be some New York reps and some New Jersey reps. But because the counties in these 2 states, only the large ones over 500,000 got any help before. Everyone else, the states kept the money. So it's frustrating, but you know, in a $1.9 trillion bill, you can point to a lot of things that you don't like, but you're never going to get a perfect bill like that. That's just the way it is. So, you know, I'm happy that local governments are finally getting some support directly, and that's a big deal for us.
Congressman Cadco voted no when the House had its first go at this. They'll have to vote again on the Senate version. But he's been an ally on this, yet votes no when the bill is before him.
Yeah, it's called a poison pill, right? There's things in the legislation that I spoke to the congressman today. I think he's an undecided on this, is how I took the conversation. He likes us getting help, but there's other things in the bill that he's got to come to grips with. So he can speak for his own vote. I would like to see some bipartisanship out of it, but we'll see what happens.
Would you have voted it? Would you have
I don't
voted
even.
yes?
I haven't read the rest of the stuff, Andrew, so I don't even know. Out of the 1.9 trillion is a ton of money. You're gonna have a lot of things in there that you can question the effectiveness on. I think you kind of got to look at it with how many things do you support in it and weigh that against things. You're never going to support every single thing in a bill. But I haven't even read it, so I can't say. I've been laser focused in on the one element of the bill, which is going to help me do my job better and help my constituents recover from this.
Executive, you said that you asked for less this time around as opposed to the last time when you were asking for a number of vaccinations. Can you take us through what that process is like and why specifically you asked for less this time than last time?
Well, I didn't ask for less. I'm today on the call. We won't ask for as many because we aren't filling as many appointments right now. So last week we got 6,600 combined, but our base allocation was the same as this week. So this week, I think strategically we're going to ask for another tray of Pfizer and maybe some more Johnson & Johnson. But if we knew that they were going to open up eligibility today, we would have asked for more. But we don't want to be in a position where we're sitting on. We'll never waste vaccine. If we ever got to the point where we have 500 vaccine and it needed to be used that day, I would go grab people off the street, and I don't care if they're eligible. We won't waste a shot. And then if anybody's got a problem with that, too bad. But we don't want to get in a situation where we're asking for more than the demand in the public. So it's a balance. I hope the governor comes out and says eligibility is going to increase tomorrow or the day after, and we'll be behind the 8 ball a little bit, but we can always ask for more as well. But if we get an extra tray of Pfizer and a little bit more Johnson & Johnson, we'll probably have about 6,000 doses again for this week. It just won't be 6,600.
Are you through the on list?
Pretty close. I think after this week we'll scrub it again, but I think we're pretty close through it, yeah.
How are restaurant vaccinations going? I know that you were working with associations to kind of do a pre-registration.
We did, and then and again, what happens is we're working with these groups, and the employees just go to the fairgrounds, and so we vaccinate a lot of restaurant workers. We'll continue to, but a lot of them already have received their vaccine at the fairgrounds as well.
Ryan, there's some increasing calls for Governor Cuomo to resign or to be impeached. Do you have a view on that?
Yeah, I believe that there needs to be a thorough investigation, but I think related to any calls for resignations or impeachment from my perspective as an executive, I want to see how it impacts the state's ability to function. We can't have a broken government right now when we're trying to close out a pandemic here. So I think the investigations need to happen and happen quickly. And I understand that there are legislators and others who have called for that. I'm not. I'm in a position where I want to make sure we can govern. If we're governing and things are getting done, and this isn't absolutely a distraction, let the investigations continue and get done with quickly. And then the appropriate bodies need to deal with that. Right now, I haven't seen the governance relationships shutting down. We're still getting vaccines done and whatnot. But at any point, if that changes and this situation is paralyzing vaccine distribution or response to the pandemic, I think things change. One of the things, Tim, in the last week's bill out of the legislature, the certain pandemic powers need to come back to the local governments. That's something that I think certainly we got some of our powers back, but certainly there's no reason why Onondaga County can't govern the hours of operations at our restaurants. We're the ones who enforce it. There's certain powers that at this point in the pandemic, the New York State should not have, and they should be back in local control. Other questions?
Just on schools, does it look like, as you're talking to them, are we headed toward most of them implementing kind of a 3-foot rule or some looser rule toward the end of March, or when do you think?
Yeah, I think you're going to see that spring break is that last week in March. I think you'll see when people come back moving towards the 3 feet with the partitions. I think that's what a lot of districts are doing. We ordered a lot of partitions today. We'll continue to order more so that they're ready to go. And I think we'll have a good 2-3 months worth of in-person learning at the end of the school year.
What's a lot? Can you ballpark?
What do we do? 12,000 today? 12,000 today. We'll at least order probably 3-4 times that in the next few weeks. We're just going through different partition models and different things with the districts.
And those are not necessary on buses, right? I think Dr. Gupta said the seat back is enough of a separation.
Correct. And again, the part of what's being looked at for buses is 1 child per seat. You have, obviously, the seats are bigger than the little ones for most cases. But then many of the issue with the busing has always been, if you're within the 6 feet, how long are you within the 6 feet? And so under 15 minutes, I know Dr. Gupta is looking at under 15 minutes having the children be able to sit next to each other as long as everybody's wearing masks and the windows are down a little bit in the buses, et cetera. So she'll give more guidance to districts on that this week.
Thoughts on the CDC guidelines about vaccines and masks and what you can do when you're vaccinated?
Wow, I mean, it's good to see some adapting, right? So I think wearing a mask is still, in the public, the right thing to do, and people should continue to do that. Certainly, if everyone's vaccinated in a household, you can understand how maybe you wouldn't wear a mask. So I think the CDC is catching up with the reality of the situation there. But the country's doing much better now with the vaccinations that are happening, and specifically our seniors. I think our seniors, we're doing homebound vaccinating this week as well, and we'll continue to identify homebound seniors to get to them, but with the Johnson & Johnson shot. But I think overall, our seniors are pretty close to being vaccinated. Just from, and if any senior is not vaccinated, reach out to us. We're going to get you a shot.
Have you been briefed by the Onondaga County Sheriff about the deputy or officer or trooper, we don't know whom, involved shooting that happened last week?
I wouldn't be briefed by the sheriff on that. The 911 falls under our direction in our jurisdiction. So familiar with some of the details, but certainly that's obviously a very sad situation and one that is still being reviewed.
Do we know which agency's member fired his or her weapon?
I don't. Other questions?